Hello, my name is Charles Livingston. I live in Las Vegas, Nevada. We've been there since 2005 when we were living in Mississippi on the Gulf Coast. So we experienced Hurricane Katrina and had to go somewhere, so we went to Las Vegas. Several years later, after having some symptoms in my abdomen, there was a lot of confusion as to what it could be, and I got various and sundry diagnoses until one day became very ill, went to the hospital emergency, and like millions of others, you got an appendix problem, and it burst. We did the appendectomy and came out of it, and when the surgeon came to visit me, and this was done in Las Vegas, the surgeon uttered the infamous words, "There's something weird going on in there." When I asked what she meant by that, she says, well, when they did the laparoscopic surgery to get the appendix out, she said she saw something in the peritoneum. There's something odd going on in there. Come see me in a couple of days and we'll talk about it. I was already worried about, geez, I'm going to miss like 2 weeks of work. Holy mackerel, because of the appendectomy. This is crazy. I got to get back to work. Go see the surgeon, and she said that she needed to refer me to an oncologist. He says, forget everything I told you. There is nothing anyone can do for you. You need to understand me. No one can do anything for you. So you might want to, in the coming months, you might want to talk to someone. Here's my card. You can call me and we'll chat. I needed some clarification, and he says, well, I'll be back in a minute. True story. Comes back a little while, says, actually, you got about a 20% chance of surviving a surgery that can be done 2 places in the United States. If you survive the surgery, you got about a 20% chance of living another 3 years. That made the drive home kind of challenging. Go to another doctor who refers me to the Mayo Clinic. We begin talking with the Mayo about performing this surgery, which is a debulking, is the term of the surgery, debulking with hyperthermic chemotherapy. My first trip to the Mayo Clinic was unlike anything I had experienced in medicine. Again, I'm not going to tell you that I have had enough issues through my life to make me an expert on medical care. But when you come to the Mayo Clinic, as I tell everybody, first thing is you got an itinerary. This is where you're going to be when, this is who you're going to see, this is what you're going to do, and they make those times. That's pretty important, particularly when things are up in the air as to what's going on. My Mayo Clinic surgeon was Dr. Nabil Wasif. Was obviously quite anxious when I came to see him the first time. My oncologist, hematologist here at the Mayo, Dr. John Camariano, was also involved. I found both of them in my first meeting to exhibit a genuine concern for me as a human being. This was in October of 2010. I'm speaking to you today, on what day is it? It's April 22nd, 2014. I'm in bonus time. I call it bonus time. I'm a long way past what that 20% of surviving another 3 years was. I've been told since day one, before and after the surgery, that this condition should be expected to come back. That's why I travel from Las Vegas to the Mayo Clinic in Phoenix or Scottsdale a couple of times a year since then. To me, a trip to the Mayo Clinic from Nevada is worth every penny. The care that I get at the Mayo Clinic in Arizona, I'm not sure at what point I would say that's too far to go. for what they've done for me, can't put a price tag on that. So when I see Dr. Camariano today, if he says, you're done, we'll see, that'll be great. If he says, see you in 6 months, that'll be great. I do have a different outlook on life, no question. And during this recovery, you know, a lot of things have happened that I wouldn't have expected before. All of us face that. I had written a book before I got ill, a book titled Gabriel's Creek. The main character of the book faces learning that he's terminally ill. I didn't know anything about that before, and I wrote it. Now I know a lot about it. I didn't have to edit much of it towards getting it published, which I did recently. But I can tell you that in the acknowledgments of my book, which is under the author name Alan Livingston, which is my middle name. In the acknowledgments of my book, I do thank the Mayo Clinic, and I thank Dr. Wasif, and I thank Dr. Camariano, and I know they want no credit for that. I know the Mayo Clinic doesn't think they're personally responsible for my being here, but I'm telling you, I think they are. I feel like they are. I feel like Dr. Wasif. I feel like Dr. Camariano. I feel like the staff at the Mayo Clinic and hospital in Phoenix and in Scottsdale. I have nothing but positive things to say. Should I continue on and have other issues to deal with, which I think would be great, I will look to the Mayo Clinic to help me through those medical issues, and I advocate that for anyone.